Minds and Machines, Shaping the Future of Mental Health.
Hi, to the numerous people watching us. So this is a discussion about mental health and where to go from here, really, from a digital perspective. I guess sort of it's quite an interactive discussion. We have a few pointers, but hopefully it'll be as interesting as possible. So the first question, which I mean, we already went through the introduction, so we don't need to go through them again. The first question, which probably I would like Dr. Rosian to start with this, is digitalization mental health systems the way forward? And how can we digitalize mental health information, such as case notes and assessments, and in the context of balancing risks and benefits of having an effective model of digitalization, but at the same time, potential leakages, potential hacks, sort of where to go from here?
But digitalization is a must. It's not an if. If we really want to look after the patient, because we have one patient that roams to different hospital environments in different situations. So a patient is not only a mental health patient, it's a patient with other diagnoses. They have diabetes, they have bone problems, they have all the other problems that other people have, together with mental health. So I really believe that we should have a very robust IT system, an electronic patient management system that is visible to all clinicians and to all health professionals, depending on what the patient would need, with barriers so that you would have data that should not be seen by certain categories would not be available, but it would be available on coding. You can, there's a word that I'm trying to find, which is escaping me now, but you would connect a code with a patient, and then you decode that whenever is needed. For example, if the patient would be involved and need emergency care. So doctors and the emergency team would need to know on what type of treatment that patient is, on all the treatment that he's having, not just diabetes or whatever he has, or they would need to know to be able to give holistic care. So yes, I am very much in favor of having an electronic patient record IT system that is robust enough, that goes round, that even perhaps eventually cross borders as well, because patients do go abroad and patients do travel, and they can travel for pleasure, and they can travel also for medical treatment. So it would be easier for everybody. So there's one language, easier in terms of data, and easier in terms of notes, easier in terms of radiography and oncology or whatever. Everything would be all in one place, and also it would move with the patient wherever the patient goes, even for the private sector. So the patient decides to go to the private sector, they can access his details through a unique code, and the patient can have holistic care. So even if he goes to the dentist or whatever, I really believe that we should have a robust enough IT system that follows the patients. This is really patient-centric. And then as for the cyber attacks, then it would have to have good cyber security that would be tried and tested, and you'd have the necessary. I'm not an IT expert in that area, but you'd have like the banks have. That would be as strong as a strong system that wouldn't be easily hacked. So the patient would benefit, the professional would benefit. I think from this approach would benefit a lot of people. And even if we hook this then with an AI system, that's where everything is going. Mental health might be the last thing that hooks onto this because of various reasons. But if you can have an AI system that would also be there for crisis management, that would filter what is crisis, what is when you have someone calling in, that would sense, it would be sensitive enough to say, yes, this is a crisis, or this is not a crisis. We need this kind of technology because everything is advancing, everything is moving forward, and mental health should not be the one at the tail of it. We should be, literally, everything goes with the head, so we should head that too. Be careful and with all the necessary precautions in place. But I think, I strongly believe, it's not just I think, that an IT system is the way forward.
And you mentioned sort of continuity of care, in fact,
Yes.
and I remember working at the emergency department and being all frustrated because I have a patient in front of me and I have no idea what happened in these past 10 years. And obviously the patient, sometimes they won't remember their medication list. So yes, definitely. And I started with you because since you're CEO of our mental health system, so it's great to hear that you're so in favor of this change.
Yes, I am. A couple of months ago, I was the CEO of the primary healthcare. And before that, I set up the pharmacy of your choice whole system. And it depends, they're all run on IT systems. Primary healthcare, we did away with the files. There were no physical files, and that did great changes, and the patients benefited greatly because this primary health is distributed across Malta and Gozo, so a patient could go anywhere. You don't need to go to where your file is or wait for your file, or if they don't find your file, they'll open another file, and you'll end up with a lot of files going around, and that is also, there's no continuation there. So yes, I really truly believe that in this day and age, if the banks can do it, and if you can do it with your money, you can also do it with your health. So I really believe in that. And I'm pushing forward so that we will, next month, we should be going onto the dashboard. So that is already something which is not exactly a patient's IT system, but at least is a very big step forward in our case.
Yes.
So that we start.
Thank you. Any input from your end? I started with Dr. Rosian because it's her field, but is there anything else you'd want to add, or shall we move on?
Just one comment. I'll be blunt here. We should not have been having this kind of discussion, honestly. There's so much of gains, outcomes waiting for us if we could just share more data, a lot more. Let's just be blunt, okay? Any disease, whatever, rare disease, non-rare, cardiovascular, whatever, name it. All of them, how much could benefit if today you'd have 1 more million patient data on their disorder? Just do the math. How much faster could do advance of treatment, so on, so on, so on, care, and so on, so on, so on. And today, 2024, we have all the tools, there's all the technology to make it available, to share, to guard, to take security, to cross-border, etc. We all use, tools from major corporations that we don't need to name here. And when you move to a country, when you come to this conference here, how much configuration do you have to change? 0. It exists already. We have the technology, we have the need, we have the capability. We should just push it forward, just make it, whatever, This is the default answer. You will share your data, and we'll make sure that is security and et cetera, et cetera, et cetera, et cetera, and it will be done for research. And if you don't want, you have to, unmark kind of thing.
All right, okay. So the second point, second question I have is, mental health is a holistic term within a holistic social and clinical framework. Everyone uses mental health, technically, for all kinds of settings. And most mental health symptoms actually would sit on a spectrum. Now, whether it's autism, whether it's anxiety, whether it's depression, whether it's psychosis, it's a spectrum. Should digital applications and devices specify what they're tackling, whether they're tackling mental disorders or whether they're tackling the well-being of the person. I don't know whether you'd want Alex to share.
Yeah, I think in today's world, I don't know if you guys would agree, but when people say mental health, most of the time they still mean mental illness. That's fundamentally incorrect. Every single person has mental health, right? It could be good, it could be bad. Sometimes it's so bad it becomes a disorder. Sometimes it becomes a chronic disorder. Sometimes you're born with it, sometimes you develop it. But the idea that we have to, I believe that we have to first uncouple mental health from mental illness, because when you're treating mental illness, that's an acute treatment. That could be an interventional treatment where you're going into an inpatient or an outpatient facility and getting specific treatment. But frankly, I think everyone should be working and monitoring and building resilience around their own mental health. You don't only go to you don't go thinking about your physical health when you start to break bones or when you can't get out of bed. No, you do preventative aspects to stop that from even happening. You work out, you watch what you eat, you watch how much you sleep, you watch how much you drink. That's not really taken in the context. In the context of mental health, that's not really the consideration, I believe. So when it comes to labeling, some of it is going to come down to the consumer. Some of it is going to come down to health systems, what they're reimbursing for, right? I think that's the elephant in the room, like the reimbursement of these treatments and then how they're priced and who's paying for them. But the idea of labeling, what aspect of that they're tackling, many people, I think, wouldn't understand if you're saying, okay, this is a preclinical preventative, treatment. Really, right now, a lot of the consumer tech, I think, it's using very fluid terms that aren't well defined, like wellness. What does that mean? To us, that might mean preclinical. That might mean you're not meeting the criteria for severity of symptoms. For someone else, that might, be a spa thing. So, I think first, we're still not even at the point where these terms are defined well enough for the public to really understand that.
I think I'd add to that. So I think when we look at the general patient population, we don't tend to see that they make much of a differentiation, as you said, between mental illness and mental well-being. And I think, especially from a tech perspective, a lot of the differentiation and the terms that we use comes down to the regulatory position of the different businesses within this space and how much that they want to claim that they're doing, how much they want to claim that the difference they're making really. And so from a medical device regulatory perspective, of course, there's a huge difference between you saying you're dealing with mental illness versus mental well-being. But sometimes, from a patient perspective, that can just be semantics as well.
Two things I'll add to this conversation to my colleagues here. You're 100% correct. It's not a binary thing. It's not I am X or Y. I'm in the distribution curve. Genetically, for some disorders such as schizophrenia, may be more predisposed to that, like a lot of many types of cancers and so on. And a lot of that is part of our social environment. So we have to do the same way that many of us do, like when you track status and how many hours of good sleep you had, and good habits, and avoid bad habits, and so on. A lot of us do this, and we should do the same, using the tools that we have today for mental health or emotional health or whatever you want to call it. The second part of the coin, which is again the challenge about labeling, and if you don't use labeling, it's difficult for you to be part of the regulatory system, get reimbursement, get medication, so on, so on, so on. So without the caveats taken, and I will say things that I have heard from many psychiatrists, we quote unquote should burn the Diagnostic Statistical Manual (DSM) and we start from ground zero. Because the way that a lot of these disorders have been described and established, especially in terms of one neurotransmitter, or the effect of one neurotransmitter, a little bit more, a little bit less, will confuse that have a disorder 1 or 2 or 3 or 4. That's 1960s, 1950s. It's a lot more complex.
If you look at it from a different perspective, it's like we take care of our mental health so that we won't go for the mental illness. So the mental well-being is part of taking care of it. Like you said, we take care of our physical. I mean, mental is also part of the physical. It's not different, but for the sake of the argument, it's like you take care of your image, like by, as you said, you train, you do exercise, you watch what you eat, what you drink. For mental well-being, so that we safeguard our mental well-being, we need to be aware that we must. There must be a level of serenity, a level of approach from when we're young. From the children, we start from the children. We introduce as part of a curriculum that meant, like the slogan that we have this year is your mental health matters. Your mental health is if you keep it well, then it will serve you better. So it's easy. It's easier not to go where you shouldn't be walking towards, by avoiding certain substances, by doing certain things, by sleeping well, by drinking well. It doesn't necessarily mean that there's a formula that nothing will happen to you, but at least you do your best so that you would avoid it. It's like diabetes. You don't take excessive sugars so that you would not be diagnosed with diabetes, but that doesn't mean that it won't hit you along but at least you're aware of it, you're conscious of it, and there's enough information in your head what to do and how to choose. So mental health and mental well-being are part and parcel. For me, they go hand in hand. And for diagnosis and for the professional, it wouldn't be mental well-being. You have a mental problem, you have a mental diagnosis. But until then, the importance of keeping your mind healthy, your body healthy together, that would be a very good way of how to avoid and prevent as much as possible that you fall a patient of the mental health. This is not really what you want to hear, because you would end up without patients.
Or different kind of patients. I think, in conclusion to this point, I think some very valid points on the importance of diversifying what the definitions are, so what mental health is, what mental disorders are, and what well-being is, which ultimately it's part of the definition of health in general by the World Health Organization, but they are all intertwined. So I think maybe a take-home message from this is that when we want to build an application or a technological device, because ultimately that's why we're here, that application would actually specify what am I measuring. So if you have, for example, we see a lot of these terms, as you said, Alex, sort of mental toughness, wellness, but what does that mean? And I think maybe in the introduction section or in the startup section of such applications, perhaps there'll be something to describe what is being measured. I think it's very important. We'll move on to I'm mindful of time, move on to the third question. So we have seen mental health systems around the world improve, especially over the last half decade. However, there's a long way to go to meet the expected standards and ensure parity with other health systems. What are the biggest impediments to mental health innovations and new ideas? So perhaps we can...
Again, I'll be stirring the pot. I would start with the mental health professionals. More than the organizations, more than the structures and etc. Of course, it is the job, it is the main duty of a professional in this health sector, a nurse, a cardiovascular instrumentalist, or to focus on the patient, right? That's why they signed an oath, at some point in their medical career when they completed university and so on. And that is, and that should be the number one thing. And that includes that if there are things that are appearing today that you did not learn in your medical school because they simply did not exist, it doesn't mean that you should not take into account. And if you think it's adequate and considerate and etc., just implement in your routine. Don't have to wait for that many of 20 years or whatever it takes for something to become their normal conduct to bring that benefit to your patient. Think about neuroimaging. How much has it evolved? from the first MRIs, 60s, whatever, to what you have today. They're expensive machines, we know this, and et cetera, But let's just suppose that, I'm a neurologist today, I said, oh, I did not learn about this particular, instrument or this particular approach, this particular data set, therefore not use that when I'm doing neuroanalysis of my patients. That's ridiculous, right? So again, take the professional, mental health or whatever professional, to be at the forefront of consuming and implementing and advocating new things in the procedure. And of course, and always following guidelines, following the care of the patient, etc. But be challenge-driven, not be just a patient, someone waiting for something to be certified and told, top-down, that you should start using XYZ technology. So, get that mindset, mental health professionals. That would be my first thing as a first blockade to, and then you have the rest. Then you have the the administration, the procedurals, the certifications, and et cetera, but just be hungry for the benefit of the patients.
No, I agree completely. I agree. With all the professionals that I've been working with, it runs when the professional wants it to run. So, and it runs as fast as the professional wants it to run. And sometimes that is a very big step. The first step is like when the babies learn to run, and when they first learn to walk. And that is the mindset of the professional. You say, yes, we do, we need. When you say we need, the felt need for the professional. Malta, we're very small, and a telephone call away for everything. But the felt need by the professional is the base that launches the platform to become IT driven. And unless the professionals want to be IT driven, then it would facilitate my pathway in our cases. But I push from my end because I really, as I said, truly believe in IT, and I agree completely with what has been said. That is the professional who pushes it.
From what I'm hearing, sort of creating a form of shared social identity and motivating the employees will probably help drive the system forward. But obviously you need to see, from a leadership perspective, how to get the employees working with you, and probably you can vouch for sort of it's probably a bit tricky at times.
It is, because the thing is, we are not testing the waters. We are not the first one that, this has been tried and tested. Applications have been tried and tested before. We're not reinventing the wheel. So if it has brought great benefits for the patient and for the professionals elsewhere, so why not here too? We can adopt, and we can obviously adjust and improve, because the more people are on the systems, the more improvements can be made. But yes, I think the bold thing is that you need to move forward and profess that, yes, IT will help me. Technology helps me in my profession. It's not going to take away anything from my profession. It's going to help me. It's going to help me add on to what I am at the moment, help everybody grows, and the patient will benefit.
So we have, then we'll have some extra time, maybe, like football, eh? We'll have a minute and a half. Aaron, we spoke about this yesterday. So digital platforms may have ethical implications around disclosing information and contacting third parties. Should the person's safety be at risk? So, for example, if someone mentions the term suicide, or someone mentions harming other people on the application, in such situations, should the digital platform management be obliged to disclose information to relevant authorities, such as hospitals, crisis teams, police, if the person's safety or other people's person's safety is at risk? So a question of liability, as we were saying yesterday. So sort of who would be liable at that point?
Yeah, I think it's a really, really great question. There's so many factors at play. There is, obviously, corporate responsibility, there's legal responsibility, but we also take into account that people are coming to services to, engage with them, and they expect privacy. They expect that their health data should remain private, But then, of course, there's the question, as a clinician found a business, you also have a duty to do good and a duty to protect people from harm. And so it's almost an ethical consideration of what do you do as a clinician-founded business? Do you share data and breach someone's trust? Or do you not say anything and hope things work out because you want to protect yourself from a liability perspective? But also thinking long-term as well, if you breach someone's trust because you want to protect them, if you share their data with the authorities, you also need to think about the long-term willingness of that patient to engage with future services, whether next time there's a crisis, whether they'd be willing to seek support and seek advice from technological services as well. But I mean, I think overall safeguarding is a key part of any innovation that we build within mental health, because that's a clear area where we can do a lot with artificial intelligence, with accessibility through tech, just to be able to pick up everyone who may be at risk.
Yes. And the long-term existence of the company itself, because obviously then if the word goes around that, listen, whatever I tell them sort of is going out, I mean, and the fact, yesterday, Alex, you were saying from a liability perspective, sort of, if, imagine the owner of this company, CEO of this company happens to be a clinician, but ultimately you don't have the clinician cap there, sort of, you're not a warranted, sort of, is that company's, that application's duty to ensure the quality of the message, the transmitting of the message, and to make sure that it's doing its job well as a program, or ultimately, as Aaron is saying, sort of there are these implications and the safeguarding that you have to keep in mind and disclose information?
Well, I think it's actually the duty of the company to get as much information as possible about a case like that. I know maybe a cop-out, but the solution to this question is more tech accuracy. Now, if someone is saying that they are suicidal, you as a company should be employing all possible measures to determine intent. Is this ideation? Or is this intent? Is there planning involved? As in, you need more specificity, which we can get through technology. We can pick that up through natural language processing cues. We can get that from biophysical readings. So I think you as a company, and this is I think where it gets a little complicated, because you as a company don't necessarily always want to use someone else's tech that you haven't developed. But it's a competitive financial startup world. At the same time, is there a duty if there is that technology for you to use it? I don't have an answer to that. I think it's a philosophical one. But what I'm saying is that to this question, the answer is paradoxically more tech, more specificity.
Quick one, so you're running out of time. On this particular subject, I wrote a proposal at the beginning of the year with the Spanish authority that was not able to implement about suicide ideation. If anyone is interested, let me know. I would be glad to get the ball rolling on that one. It's very important for many reasons. But back to your original question, I'll choose the Buddhist way. I think the answer to the question is the middle path. Okay. It's not clearly A or B. Of course, we want to do. But subsequent to this, I'll ask my scientific mindset, which is what are we optimizing for? Okay, and for me, the answer is we're optimizing for the benefit and the safety of that individual, not for the corporate, whatever legal, etc., etc., etc. So that's what it should be. In my view, we should be optimizing for, and clearly, and I could go into many details of suicide statistics and so on. But we're not. But again, happy to continue the conversation on this later. Of course, if you have the opportunity to interfere with someone who is considering the ultimate decision of killing himself or herself, and if you have this opportunity to give a hand or make a call or do whatever it's within your reach. And if you're someone like me, who, and probably most of us here in this, entire building, we care for the other, and we care for the health of the other, and care for the mental health of the other, just do it. And if you have some technical solution for this, even better. But if it's someone next door to you, do it. Okay.
So I think that's us really. This was a bit of a sensitive topic, so if anyone maybe in the audience would feel that this was a bit too sensitive, too much for them, please reach out. There's always help. So thank you very much to the panel, and have a good afternoon and a good evening.